So I'm really happy to be joined now by two dear friends and wonderful colleagues. I've had a chance to visit their country many times. It's always been spectacular, and two excellent surgeons, Dr. Ryohei Yozu and Dr. Yukikatsu Okada, both from Japan. Thank you for joining us. Thank you for joining us.
My pleasure.
You know, we've had many. You went to a baseball game here in New York, so you've seen the Yankees play. So what could be better than that? So let me ask you, what's the state of mitral valve repair in Japan?
All right, that's a good question. We have a number, about 60% of the mitral regurgitation. We do the mitral repair.
So 60% of mitral regurgitation is you do it by repair.
Right.
Yeah.
And that's obviously much higher than it is in this country, because we still do, unfortunately, a lot of prosthetic valves. Why is it different? Why is it different in Japan? Is it your leadership, or is it why is that so different?
But actually, I don't know. They're quite different. The difference, but in Japan, as so-called, we have so many training programs, and annual meeting and the well lab, and at least I attended such kind of a training system, maybe 10 times annually. Anyway.
10 times annually?
Annually.
Goodness gracious.
Yeah.
So
In addition to that, the Japanese, doctor, very competitive. Then the Japanese seeking the best.
Okay. So the Japanese citizen would seek the best.
Yeah.
That's interesting. And it's a smaller country to some extent that you could move around. But I think it's interesting that the training programs have been heading in this direction. Plus the fact that you both have run many courses, had American and European colleagues come, so you push the field forward. Have there been advances in your technology or your technique? If we look back 10 years ago to now, what's been the change in the technique?
But at first it's very important to inform the so-called late result between quite a big difference between the patient with valve replacement and valve repair.
Right.
It's very important to inform at first the cardiologist, and then cardiologists recognize valve repair is better than valve replacement. It's the first step.
Absolutely.
And then the cardiology, send a patient in the cardiac surgeons,
right,
who are very much good at so-called mitral valve repair. That's the reason why. So the other cardiac surgeon should have a technique to how to repair the mitral. Anyway, that's the reason, I guess.
I think that's very, very important. And the other question is about the technique. In other words, have you seen a change in the way you both operate and the way, tell me a little bit about that.
Okay, the repair technique, with the time, it changed. So we have many, new technique, and technique we learned through the course. Then it was reflected to the patient. Yes.
Okay.
But now, currently, we have so many techniques. But anyway, we have now so-called intraoperative transesophageal evaluation just after repair.
Image. Yes.
And now we don't know which repair is durable. But anyway, the good coaptation, makes mitral gone. And
it's an interesting problem, because you're right. I'm obviously not a surgeon, but I'm sitting here and there are all these techniques coming and going, and you want no MR and durability.
Yeah, it's very so that's a problem in the future. 10 years future, 20 years future. We don't know, but anyway, we can make a good coaptation with that mitral gauge in the operation.
Right.
That's the first step. So now we can, but the future, which procedure is durable?
We'll find out.
Yeah.
Let me ask you about tricuspid valve surgery, concomitant. What's the status?
Tricuspid valve is a forgotten valve in the past.
Forgotten bad now.
Now, it is not the forgotten valve. We have to pay attention what treatment to the tricuspid valve. Now we realize and we started to repair gradually. Yes.
Okay, so doing more truck
Yes.
along with mitral
It's
valve repair.
right.
Yeah. In my practice, almost 55% of the patients who underwent mitral valve repair for mitral regurgitation require also simultaneous tricuspid. HFA, PH, moderate,
So
severe.
that again.
But it's a timing of surgery. Okay, so the guideline, proposed as so-called early surgery. So if I operated so-called early time of surgery, no regurg, sinus rhythm, small ventricle, small right ventricle, no regurg,
Right.
that's mitral only.
I understand.
So it's very important to manage the patient much earlier.
I understand exactly what you're
But
saying.
concerning tricuspid bridge, we are now focused on the diameter of tricuspid diameter, not the grade of tricuspid bridge.
It's annual size.
It's very important to assess by echo. But we don't have yet a so-called standard number of annual size.
Absolutely.
So we have to focus how much length is the so-called how much length more than how much length, or 4 centimeter. We have already 4 centimeter
Right.
in tricuspid annual diameter. For Japanese people,
But that might be, if you're small, it might be too big.
Too big.
By body surface area is what
Yeah.
you're saying. You really have to. Well, I mean, you both have. You've done so much. You've traveled obviously great distances to come here to this meeting, but you've done so much for education in your country, and I certainly have enjoyed it. Just your final thoughts quickly on the Mitral Conclave. It's a very, very good educational activity, isn't it?
Yeah. Yes. Now I finished the wet lab on the second floor. I learned a lot. New rings.
So in the wet lab, did you really?
Yeah. I enjoyed it. But to come here from Japan, money, time, it is difficult.
It's a lot of time and a lot of money. I know that, but we always learn from you when you come.
But it's very important to have so many strategies.
And exchange of ideas.
By the patient condition. The patient condition is not only the so-called the one condition.
Right.
We have to change our strategy depending on the patient condition.
Absolutely.
So it's very important to obtain the so-called different information, different technique, and it's very important. So this meeting is very much
Very
informative.
outstanding.
Yeah.
Outstanding meeting. Yeah. Well, that's the word I'd use for both of you. You're both very outstanding. You're good friends. Thank you, Yuki. Thank you. Good to see you, Ryo. As always, good to see you. Thank you. Thank you for coming.
Yeah.